Hi, my name is Dr. Carter, and in this chapter, we're going to be going over Chapter 1, which is Evaluation and Testing in Nursing Education. We're going to explore various assessment strategies, testing methods, and evaluation frameworks right from the beginning. All right, so here we go. Let me go ahead and share my screen. Okay, so here we go. All right, so assessment and the educational process. Chapter 1, we just start at the basic fundamental concepts of assessment in nursing education, and it'll kind of set a foundation for the framework for what we move on throughout this class, looking at how assessment integrates with the broader educational process and its critical role in developing competent nursing professionals and especially educators. Okay, so let's just start with some basics. Assessment, measurement, and evaluation. Assessment and evaluation are not the same thing. Assessment looks at collecting the information about student learning. Measurement is where we quantify it. And then evaluation is where we make a judgment about the assessment that we've gathered. All right, super important distinction. Okay. All right, so the definition of assessment, collecting information for making decisions about learners, about programs, and educational policies. So it's not just about teaching students. We gather assessment just to even look at our program outcomes in the whole program of nursing. Are we meeting those outcomes? So assessment is beyond what we teach in the classroom. Um, and it guides instructional improvements and validates educational effectiveness. Okay. Sorry. So principles of effective assessment, identifying the learning outcomes. First, we have to have clear objectives about the competencies and objectives that we're assessing. Match the strategies to the outcomes. So select assessment methods appropriate for each learning objective. Meet the student needs in helping them learn to meet those objectives, and using multiple strategies for assessment. So for example, you don't just want to do one type of assessment because maybe a student isn't really great in that one that you chose. So we need different types of assessment to assess the learning outcomes. All right, so we need to create learning outcomes and objectives. Think about how are we going to teach those, make sure we meet the student needs while we're doing that, and then assess them in multiple different methods to make sure they learned those initial objectives and outcomes that we set for them. Okay, so assess tests as assessment tools. We'll be going over all different kinds of assessment strategies in this course. Tests represent a specific measurement technique within the broader assessment framework. They're usually a structured set of questions or tasks designed to elicit responses that demonstrate student knowledge, understanding, or skill in a certain area of education. We have written examinations, skills assessments, and even interactive assessments. And we'll talk about those later, but they can be very beneficial as well. Evaluation frameworks, we have norm referenced and criterion referenced. Basically, there are two types of frameworks, and each approach serves a different purpose and provides distinct perspectives on student achievement and program effectiveness. Norm referenced evaluation compares students against each other, establishes a relative ranking within the group, and it's useful in identifying exceptional performers and those who may need additional support. Whereas criterion referenced evaluation assesses students against a preset standards and compares them to those standards. So for example, norm referenced is what we would be giving in a class for an exam. We teach chapters 1, 2, and 3, and then we give an exam. And we can tell student A, B, and C are doing much better in the class than students D, E, and F. And we can compare them against each other. Whereas in a criterion referenced evaluation, think more of like ATI at the end of the semester. So we're not necessarily comparing them who got 90%, who got 50%. It's a standard. There's a standard, and they're being compared to the national standard. Okay. The evaluation process, it encompasses making judgments about student learning, clinical performance, employee competence, and educational programs. These judgments are based on assessment data, but always involve some kind of degree of subjectivity or interpretation. So we have to be careful about that. It can include multiple factors such as quality and relevance of the assessment data, the context in which learning occurs, and the specific standards and criterias being applied. We need to collect the assessment data, analyze the findings, make our judgments, and then provide feedback. The types of evaluation, there's two types, and you'll need to be really familiar with both of these if you're not already. Formative and summative. Each has a very distinct purpose, and understanding the appropriate application of them is critical. So for formative evaluation, this is your ongoing evaluation that provides assessment and feedback during the learning process, helping the students identify strengths and where they need for improvement. So for example, you teach chapters 1, 2, and 3, you give an exam, they can see where their strength is, where their weaknesses are, and we move forward in the learning process with that. Summative assessment is end of instructional assessment, and it determines what the students have learned and if they have achieved their competencies. It's the final assessment. So for example, the final at the end of the class would be summative. ATI in general, the whole ATI at the end of the semester, that's summative. So formative would be along the way, checking in along the way. Summative is the summary of everything that you're assessing. And there's places for each. Both are important. So we'll look at each one in a little more detail. Formative evaluation, again, judges the student's progress in meeting the desired outcomes and developing competencies. It occurs throughout the instructional process and provides continuous feedback that guides further learning. So it's an ongoing assessment approach and allows for course correction during the learning process, helps them refine their understanding before the summative evaluation, gives them opportunities to improve before this summative. So we can check in progress assessment, implement regular checkpoints, provide feedback, and self assessment. So that kind of, it's just a process throughout. Whereas summative, at the end of instruction to determine what they have learned in the classroom or the lab or clinical practice. Unlike formative evaluation, It focuses on judging the achievement rather than the progress. It's the main difference. Um, okay, so comprehensive assessment, high stake decisions that might be like your ATI, documentation, having them emphasize formal documentation and multiple methods. Again, you can use multiple methods for summative. It doesn't have to be just like a final exam at the end of the semester with multiple choice. It can be a final skills lab check, um, something like that even.